ambulance service. Is the patient breathing?
My name's Kim, I'm on the ambulance crew, all right?
This is the Scottish Ambulance Service.
We genuinely get to make a difference in people's lives.
The job literally is life and death.
No needles or anything on them, though. There's nothing I would rather do than this.
Serving every one of us.
It's okay, love. It's all right, don't worry.
From Scotland's busiest cities to its wide open countryside. Wherever we have fallen, whatever has happened to us.
Need a hug?
I just feel she's gonna die.
But this is a service under extreme pressure.
We're constantly apologising to people.
Yeah, it's very busy down here.
Which we rely on like never before.
We're 2 shifts down in Edinburgh and 3 in the borders. Here we go, here we go, here we go.
On the front line and at the other end of the line.
1, 2, 3, 4.
Scotland's paramedics keep Scotland safe.
Breathe the gas.
And alive.
Help is coming, they're coming as fast as they can.
This time, climbing the stairs causes a dislocated hip.
You just like jerked the wrong way.
In Fife, a patient suffers multiple seizures.
This was the 5th and the 6th.
Yeah, 5th and the 6th.
And there's only about a minute between them.
And there's a breakdown in communication in the control centre.
The guy literally speaks no English. I don't know what to do.
Livingston, 20 miles west of Edinburgh, in the heart of Scotland's busy central belt. It's the most densely populated area of the country, which makes it a busy beat for local ambulance staff. Paramedic Jamie has been working with student paramedic Anne-Marie for the last month.
Me and Anne-Marie are a team. We take turns driving, we take turns at managing our patients. We've built up a good rapport.
The job can be quite emotional. It can be physically and emotionally demanding. I think you've got to truly enjoy your job, and I think we do.
So we don't know what we're going to yet.
Fire crews are coming this way. Oh, dearie me. It's not an RTC, is it?
It's not coded, is that?
Oh, I'm going to another ambulance come towards it. It's all go here today.
RTC caller not directly seen. 1 female with head injury and abdo pain.
Right.
RTC died on impact. The people that die from RTCs, they die from other complications. We knew it was quite a fast country road, so we knew it was probably going to be quite a high impact road traffic collision.
Here we go. Quite a lot of people. Probably best leaving it just in front of these people.
No, and where they are.
I'll ask her.
Who we're here to see?
What, sorry?
Who we're here to see?
It's a female that's in the black car. She was in this one here. She's came out of the junction and it's kind of been a side-on impact from a vehicle coming the other.
It wasn't initially obvious what had happened because the patient was no longer in that vehicle that had been involved in an RTC.
Another car, hadn't
She was sitting in somebody else's vehicle.
Hiya. What's your name?
It's Carolyn.
Carolyn.
Yeah.
Hi, my name's Jamie, this is Anne-Marie. Understand you were in this car, were you the driver of this blue car?
Yes.
And you were pulling out and the cars came into your side?
Yeah.
Driver's side?
Yeah.
Door?
Yeah.
Okie dokie. When we would approach a patient, normally we would encourage them to stay nice and still, but she has self-extricated, which often is a good sign, but it doesn't rule out injuries because the adrenaline's going. All right, are you in any pain at all?
When I breathe, I get a bit of a sharp pain, but where the seat belt was across...
Kind of where you'd expect it to be from that?
Across here in my belly and the top of my leg, but my shoulder is probably the same thing, I imagine, and just my neck's a bit sore, but I did fly forward and back into the seat.
Okay. There's a lot of forces going on at you, so you've been kind of pushed from one side, come to the other side, and then going forward, hitting off the dash.
Yeah.
Now, it's not always really obvious when people have these spinal injuries, and you have things called distracting injury.
A distracting injury, the patient would be more focused on where they can feel the initial pain, and with the adrenaline surging, they're not realising that they actually are sore in their spine or their neck.
Sometimes people come out, they feel fine, then they move a certain way, and something just sort of cracks, and it's like a sort of spinal injury, and that's the main concern. Yeah, I'm going to press down on your spine. I'm going to move this. So try not to move too much, all right? Now, when I've been pressing all the way down there, you've not made any...
No, it's more across to the left the way, and that sore is almost like muscles.
Right there, yeah. So that's your muscles, that's not on the bone. That's a good sign.
Further up on the left-hand side.
So it's up here, it's not on the actual spine.
No, it's just, that's it, yeah, it's just to the side there. Okay. Sorry, that's it. That's where it is,
I'm not pressing any harder than that.
No.
All righty.
Sorry.
Now, how concerned would you say these pains are?
Oh, I don't know. I feel aching across from my neck, where my neck is. It's aching, it's not sharp pain. When I was doing my breathing in and out, I had to be careful how far I was breathing in because I could feel a bit of pain.
It was awkward because she's already been up and moving, which means obviously it's not a complete fracture, you know, it's not completely displaced at that moment, but sometimes you do an unnatural movement after that and something just goes. I think what we're going to do is be overly cautious and immobilise you, if that's all right with you. Okay. What we do is, the way that you're managing your neck really well, but to assist with that we put what we call cervical collar, all right? Okay. That helps sort of keep your neck in alignment. And we put you on a plastic board to keep your spine in alignment with your neck.
Jamie and Anne-Marie now have the delicate job of getting Carolyn from the car and onto their stretcher.
Okay, Doc, how's that feel?
That's fine.
Not too restrictive?
No, it's okay.
Right, what we'll do is we'll just step a couple of steps and sit back down, okay? Like that. Up we come. Right. Okay, Doc. Right, just step away from the car. That's it. Okay, Doc. You all right?
Yeah.
You seem very nervous.
Not just a bit shaken.
Okay, we'll get you wrapped in a blanket.
Yeah.
But we don't want that getting in the way.
No.
Okay, Doc. Right. It's awkward, isn't it? Right. Right. Bum a bit more towards Anne-Marie, and as you lie back, Anne-Marie's got your neck.
Yeah.
I'm going to lie you flat. I'm going to swing legs up towards the hedge, all right?
Okay. What am I doing? I don't know.
No, you're fine. Just see what you're doing naturally. Just go for that.
Yeah.
No, it's one of these uncomfortable boards, unfortunately, but it's the best thing for you.
Just bring her around. Other leg. There we go.
Yeah. Now, I know they're not comfy, but we'll get you as comfortable as we can.
Carolyn's son Michael has arrived on the scene.
I'll hold you myself and then we can readjust that.
No, it's okay, love. It's all right, don't worry. Don't worry, we're just taking precautions. It's okay. I know you're worried, it's okay. It's all right, love. I'm glad that you're going to be with me. Yeah, thanks for coming.
Is this your boy?
Yeah.
I don't like to make judgments. Sometimes I get it wrong.
I know, my
So
boyfriend. Yeah.
I've put my foot in it before, so I just don't like to assume anymore.
Right, let's get you out of this wind. At least it's dry.
Yeah, I know.
Threatening terrain.
To be thankful.
I'll get back to the car now, but I'll follow you.
Okay, love, that's fine. See you there, sweetie.
Once we had her fully immobilised and in the back of the ambulance and able to complete a more thorough examination of her, she began to feel quite queasy, quite sick.
Just roll up.
You all right, sweetie?
Is it coming up?
Try to get that out of your face, but I can't.
All right, sorry.
No, don't you worry. Better out than in.
Yeah.
Sorry, it's not the softest of things.
Sorry.
Do you want a fresh bit? Here we are, my love. You okay?
Still feel a bit sick.
We can give you something for that. In fact, I will give you something for that just because we've got you lying flat.
With her now vomiting as well, we then consider, does she have potentially a head injury that wasn't obvious when we first arrived on scene.
It's vital that Carolyn is taken to A&E as quickly as possible, but moving a patient who is vomiting can be dangerous. The crew need to bring her vomiting under control. It's midday and midsummer in Dundee, Scotland's sunniest city. Technician Chloe and veteran paramedic Fergie have been working together for nearly a year.
Oh, it's for boiling. And we're always out and about. We're never in the same place all the time. We're all over Tayside, and sometimes we go out of town on transfers, and yeah, it's a great job.
But working in one of Scotland's busiest cities has been difficult these last few years.
I feel like we're feeling pressure more now than what we were before the pandemic. I think we're constantly apologising to people, saying sorry, it took long for us to get here, but we're just hoping that it'll get better in the future.
Every day's a new day. Doesn't matter what happened yesterday. Well, not really, because we're going to be to start a new day with new problems and new situations and new scenarios that we're going to find. I mean, the whole world's out there, you know. Anything that's happening out there could potentially require ambulance assistance.
Today, the crew are answering a call in Tayport, on the other side of the river in Fife.
So we're going to a red call for seizure now, a 34-year-old male. It does say that he's conscious and breathing.
Sleepy afternoon, Tayport around.
I know, everyone enjoying the sun. A nap in the sun.
Came for Dundee, did you?
Yeah.
Came for Dundee, yeah. Oh,
here you are.
Sorry, up here. You go first.
Oh, thanks.
I'll take a mini breather.
When they arrive, everything is calm. But it's obvious this was quite a significant incident.
Hi, Daniel.
Hi. What's happened?
I was doing the cleaning and I said to him, Daniel, would you like to help Mum hoover? He always does that. So I went downstairs, he was hoovering here, and I heard a crash.
Okay.
Yeah, it's broken with all the broken bits.
And when we got there, Daniel was actually awake. He wasn't seizing when we got there. The family were concerned only because it happened and it happened again.
This was the 5th and the 6th.
Yeah, 5th and the 6th.
And there's only about a minute
yeah.
between them. That's what worried us.
Okay.
Yeah.
Daniel, how do you feel now?
Just a wee bit better. Okay.
Although Daniel seems fine now, seizures are potentially very dangerous.
No. Okay. Is it okay if we do blood pressure and whatnot? Have you had this done before? You'll know what to do.
I pop this in your ear, Daniel. Just your temperature. That's it. Perfect.
And what were you doing? You're doing hoovering? Yeah, well, no.
He's very good at that. You know.
Do you like the hoover?
Is he?
Yeah. It can be therapeutic, can't it? Running the hoover over everything and then looking at the carpets afterwards and thinking, oh, I've made a good job.
Daniel has autism, which the team need to take into account as they assess him.
His autism made him present slightly differently. So we had to take the cue from his family about whether Daniel seemed like his normal self. Just the way he was communicating is unusual because he's neuroatypical. I have to check your blood sugar, so it involves the wee prick on the end of your finger. Can we do that?
Okay.
You choose which finger you want me to do.
This is the finger.
This one. This one.
Yeah.
Oh, no, I felt the thing.
See us. Go ahead. We're safe.
Almost there.
Yeah, okay, we're safe.
You've done really well, lad.
Okay, we're safe.
Thank you.
Thank you. Safe now.
And you squeeze that. And then by the time you count to 20, that'll be better.
Okay. We're safe now.
5.4, and that's good.
Thank you. Safe now.
The first thing you want to see is Daniel speaking normally, is he talking normally to us, is he interacting normally with his environment. Often after seizures, people become a little bit confused.
The way he was having the seizure, was that like a normal for him, or so just that he had one after another?
Another, yeah.
Okay.
This is the first time it's happened.
Yeah.
What we do, we have to look at what's usual for that person, you know, and then compare that to what's happening now.
How are you feeling, Daniel?
Yeah, a little bit. Gone soon.
Yeah, that will be gone soon, yeah.
Perfect, well
It's
done.
away now.
Do you want me to take that?
Yeah, great.
Yeah.
You did that.
I'll take that.
You did well.
You did well.
Daniel's had a recent diagnosis of epilepsy, which complicates the crew's thinking.
There's a massive difference in how people with epilepsy will present and how their seizures will present. His epilepsy was developing. So it wasn't like he had settled epilepsy that had been the same for a long, long time. Nobody was really sure if he was going to have more seizures or how often he was going to have seizures. This hadn't happened to him before. We'd had two, one after the other, which is what had caused the original concern and which was what was giving us the most concern out of anything. So, okay. I mean, you guys know Daniel better than we do. Daniel says he seems okay at the moment. All his vital signs are good. I have no qualms in taking Daniel up to the hospital to get him checked out. Unless he has another seizure, it'll just be a babysitting job, you know. So whether that's in your and Daniel's best interest or not, only you can make that decision, you know.
I think he's fine.
It's fine, just, you know.
Yeah.
Us being here is not helping either, Daniel, is it, you know? Just another hassle for you, Daniel, eh?
Yeah, you're right.
Really, I don't know what I have to cope with, you know, honestly.
We put our points and what we found, and then the family spoke on his behalf, and I think we all came to the conclusion that he's better off home in a safe environment with his own family to look after him.
We're safe. Like police officers.
It's the bill, you see.
See us away. We're safe, Dad. Safe.
And they knew where we were if it happened again. They knew what to do.
No worries. All the best.
You too, Daniel. Nice to meet you.
Okay, nice to meet you.
Take care.
Okay.
Bye. Bye.
Okay, thanks very much.
You're welcome. Well, we'll go get ice cream now.
Yeah.
Yeah, let's go get ice cream.
Anne-Marie and Jamie are attending a serious road traffic collision in East Lothian.
Oh, that's the one thing don't manage with.
They have immobilised their patient Carolyn to protect her neck and spine. But now she has started vomiting.
We're not maintaining C-spine at all for this.
I'm so sorry.
No, it's all right.
You're all right.
We're trying to protect her C-spine, maintaining her on that board. We're now starting to have an airway problem, which we're managing to maintain ourselves with some positioning, but it's not stopping.
I feel a bit.
A bit sick.
Oh, here we go. Ah! Hello.
We can't advocate just setting someone up to vomit at that point, so it did become really difficult.
You let us know when it's passed.
Yeah. Yeah. I think I know that when you turned me over, that's when I felt like it again, but
We'll go down
we'll
slow.
take it slow, yeah.
yeah.
Just watch your fingers. The decision making really then was just kind of let's get going. It's nice and smooth, but let's get to the hospital sooner rather than later, because maybe she is going to start to become unwell. Maybe the injuries that haven't been apparent, there is more serious injuries there.
Carolyn will be taken to Edinburgh Royal Infirmary, which is just under 30 minutes away.
Is that light quite bright in your eyes? Is that a bit better?
Yeah, I just tried to stop myself sick.
Moving in the ambulance, obviously, it's difficult. Ideally, we don't be up on our feet when we're treating patients en route to hospital. Ideally, we can have ourselves secure and have the patient secure, but that was an ongoing issue with the airway. I'll maybe just hold you best I can. I don't know in terms of... But the difficulty is we're trying to, obviously stop movement in your spine.
Yeah.
And that's kind of went out the window a wee bit, but
yeah,
at least we're making an attempt of it.
Yeah. I definitely feel better on my side.
So once I'd got her on our side, maybe the second or third time to vomit, I realised that it was actually still doing its job it was meant to be doing. Just because the way that the blocks were on her head and just the way that her arm was sitting, it was actually quite a decent alignment for her.
Go ahead.
Good evening, Royal. This is a pre-alert. We've got a lady who's been a 60-mile-an-hour side-on collision RTC with lots of airbag deployment. We're immobilising because she has some shoulder and neck pain. She's got a lot of nausea, even with ondansetron, just repeated vomiting. So obviously there's some airway concerns, just to let you know.
In the ambulance control centre, call handlers take 999 calls from all over Scotland.
Where's Liverpool?
The mainland. Liverpool's at the top.
Got it.
But not everyone in Scotland speaks English.
Russian, right, okay, stay on the line for me, okay, don't hang up, all right? Okay, do you understand? English isn't always people's first language. If not, we do have the language line, which is an external company that's used. So we dial that through, conference them in, and it's basically a three-way call between us, the patient, or whoever's on the phone, and the interpreter.
But this time, Sarah will have to improvise.
See this language line? They're trying to get a Russian interpreter, but I know I've been on hold for 3 minutes, but the guy literally speaks no English. He came on through the operator asking for a translator, and I said hello, and he went Russian interpreter.
Any other language?
I don't think he'll even understand me if I go back and say any other language. Because I said, you need to stay on the line, do you understand? And he didn't say anything, he just sat in silence.
Although Sarah can see the callers coming from within the grounds of a hospital, she can't pinpoint the caller's exact location or work out what is wrong with him without an interpreter.
What do I do if I can't get one?
Try as best we can to try and tell him to just go into A&E. Can you go into the hospital? Really?
Are you at the hospital? He goes, do you speak Russian? No. Are you outside the hospital? He's never gonna get it. I am Russian. I don't know what to do. I've never had one where I've never even had an address.
No.
I think at that point we were 10 minutes into the call and we still didn't even have an address, and our address is meant to be in 30 seconds. That's what our target is, to get an address in. So 10 minutes in when you don't have an address is really, really unusual.
With no interpreter in sight, Sarah and her supervisor Alan turn to an online translation service.
Right, I'm ready. Right, 3, 2, 1, right, go.
Ты можешь пойти в больницу.
He's speaking back in Russian.
Can you say yes? Can you say yes?
Can you say yes or no? He's speaking back in it. He thinks I'm Russian now.
Here we go.
Oh, what have you...
Can you go into hospital? Please say yes in English if you can.
Oh, right, okay, right, on you go, right. Ready, right, go for it.
Ready?
Ready.
Можешь пойти в больницу? Пожалуйста, скажи да по-английски, если сможешь.
He's speaking back in Russian still. He doesn't speak back in that one, he didn't speak... I mean, he's still there, he's hanging on. This is really difficult, oh my God. Wait, I'm not ready. You ready?
Вы можете пойти...
Usually if people have broken English, they can at least say, it's for me, it's for my mum, my sister, whoever. But because I couldn't even get that far, I really had no idea what the situation was. We're in silence now. Oh my goodness.
Just as Sarah's losing hope, she hears someone else on the end of the line.
Hello. Hi there, it's the ambulance service. The gentleman's phoned 999. Is he in the hospital or where is he just now? Can you give him directions and tell him to go into A&E in the hospital? I think it's round the other side of the hospital, round the other side. Do you know where that is? No problem. If you get any more problems, give us a call back. But if you just take him round to A&E, okay? Perfect. Thanks so much for your help. Take care now. Bye bye.
Well done.
I never done it. Oh my goodness. She deserves a medal for that.
Brilliant.
Oh, brilliant. Russian. And he just kept going Russian, Russian. But I wasn't getting anything else.
As far as Sarah can tell, the Russian man with the mystery ailment is now in A&E, thanks to a concerned passerby.
New experience every day. Every day is a school day. Wow.
In Edinburgh, veteran crew Kevin and Martin are having another busy day.
Oh, coffee.
Do you think the parking attendants are on strike today?
Oh, maybe. No, it's unusual for them not to be here.
There's one hiding up there.
Hounding us with their clipboard of officiousness.
Although based in Edinburgh, they frequently attend jobs outside the city. Today, they're heading west to Bathgate.
We're going to a 33-year-old lady. She's having breathing problems. Walking her children to school, she collapsed, but she's managed to make it home. She's got difficulty in breathing and pains in her stomach, and she's been sick.
So you haven't hurt yourself when you've fallen down or that, but you think you were actually like, sorry?
It's okay.
You were unconscious for a wee bit, were you? Okay, are you getting any pain in your tummy?
Just a little bit of taste.
Right. I'm guessing this would be unusual for you to be vomiting for a few days. Aye. Have you spoken to your doctor about it? All right, okay. You've got an absolutely raging temperature. So you've got some kind of infection going on somewhere. Okay. Let me get a wee blood pressure. Okay. That'll squeeze your arm a wee second.
Kelly had a temperature of 39.8, I think it was, and temperature's normally like 36.8, 36.9. So yeah, that was one of the flags that we thought like could be some infection ongoing, along with vomiting and diarrhoea.
Been any blood or anything in the vomit? No. Yeah. What about fluids? You taking plenty of fluids?
Drank loads.
Okay.
During the first breakfast, I'm feeling badly dehydrated.
And are you passing urine like regularly, or is it all the time? Are you?
I'm diabetic.
Oh, really?
Vomiting, you know, everyone's sick at some point, and for a normal kind of fit and healthy person, you can go 24, 48 hours having like a vomiting illness and it doesn't really affect you too much. Someone with underlying health conditions, elderly, frail, diabetic people, anyone like that who has vomiting that goes on for several hours, that's more of a concern, and you need to treat that a bit differently.
I suppose we've kind of got two options. We could phone your GP and see what they think. I mean, the other option is we just take you straight into St John's and let them have a look at you. I'll tell you what we'll do first. Let's give you... Are you all right if we give you a wee injection? We can give you like an anti-sickness medicine to try and help you with that. Eh?
Is it going to be in my bum?
Absolutely not. Definitely not. No, it would be in your arm, okay? And we'll just see if we can calm that sickness down a wee bit for you first.
But Kerry's vomiting is getting worse. Back in Edinburgh, paramedic team leader Moira is on her way to a 76-year-old male who has fallen at home in Dunbar.
He's bleeding from his nose and possibly injured his ribs as he's having problems breathing now. So we are actually the closest ambulance crew to get to him, coming from Edinburgh. And we've got an ambulance, full ambulance heading as well.
Moira's worked for the ambulance service for 14 years. Most recently, she's been working alone, supporting local crews.
There are definitely jobs that you take home. Sometimes it can be for personal reasons, as in, you know, someone's reminded you of maybe a member of your family or a particular situation. Obviously, we have to be of a certain character to be able to deal with the jobs, but we are human.
Hello, it's ambulance.
The patient has been lying on the floor for over half an hour.
What's happened?
I felt my chair moves.
Your chair moved. Did it slip? And what did you bang yourself onto?
My neck, my back.
You've hurt your back and your neck. Okay, what's your name?
Jimmy.
Jimmy. Okay, Jimmy.
He was awake, he was able to talk to me, so I wasn't concerned that he was, you know, seriously unwell. But obviously, any head injury, the potential is that there could be more going on than is actually visible to the eye.
So, Jimmy, where are you sore right now?
In my back and my shoulder.
Your shoulder and your back. Okay. And you've hurt your eye. Will you stay still just now? We're going to help you, all right? But I just want to make sure everything's all right before we start moving, okay? No, you've done the right thing.
If they bumped against something, if they've got serious pain, then the risk is that they could do more harm by moving.
Just got to have a wee feel at the back end. Stay still, stay still. No, stay where you are. Stay where you are.
If there are broken bones, they can cause internal injuries. So the advice that would be given on the 999 call is for the person to stay still.
And is your head sore? Yeah, okay. I'm going to move this case out the road.
That's the first time it's been moved for years.
Oh, is it? Well, we can put it back again. That's doing well. Right, I'm just going to wipe your eye, okay? There's just a bit of blood in your eye, so just... Yeah.
And she told me not to touch it.
I know, she's done the right thing.
Yeah, she looks after me.
Aye, good. How long has she been the wife?
50 years.
Oh, I bet you look after each other, eh? So you've just got a wee cut above your eye?
You know, I'm sick of it.
Right, just give me a wee second. Take a big breath in for me.
We checked over to see if he likely had done any damage. A quick once over down his whole body basically to see what kind of movement he had, and he was keen to get up.
Could you take my hand?
Right, I'll give you a wee hand, eh? I'm just going to grab your breeks at the back, all right? So we'll go on 3, 1. Oh, there we go, we're off. We're off. Right.
Have a wee shuffle towards me. Yeah, have a wee shuffle.
There you go. There you go. Right, take a wee minute. Good, thank you for checking. How's that feel?
A
bit better than the floor, eh? You got a fright? I know. You're all right, so?
I'm just...
They've got you up. Do you walk with your... Do you use your frame and stuff? You use it? Okay, good. Good.
I hate that. I hate that frame.
The frame?
I used to take my walking stick away from it because I kept falling.
Ah, right. Aye. He mentioned that he likes to go out every day. He gets a walk to the shop. It is a worry, and I understand somebody having a fall. They lose confidence and they're then reluctant to go back out again, which is a real shame. How long were you in the Navy for?
12 years.
Oh, were you?
I joined when I was 15-year-old.
Oh, when you weren't meant to? At 15?
I had to get away and see the rest of the world. When I was 16-year-old, I was in the jungle. And my 18th birthday, I was in Rio de Janeiro.
Oh, wow.
When I got all these tattoos, I got them in Hong Kong and Singapore to celebrate my birthday.
Oh, very good.
I got about 30.
Oh. He's a lovely gentleman, and he had a lot of stories. He reminded me a bit of my granddad, who was always keen to tell his war stories, and I sometimes think that we're maybe a wee bit complacent about that. And was that your worldly goods in that case?
That's right, yeah. Things you do in life. I went to Dundee on a ship, met the wife.
Oh, did you?
And that was it.
Love at first sight, is it?
Must have been. And I knew a lot of women before that.
Oh, did you? Killing every port, was it?
Yeah, that's what he used to say to me.
Aye. People will open up and tell us so many things and tell us all sorts of stories, and it's amazing what people disclose to us because they do trust us, and that's how it should be. Do you think Jimmy got knocked out at all?
I think so, yeah.
Right.
Or maybe about a minute or so. I heard big thump, but I've never really fell since December or something.
Right, okay.
My heart and my mouth.
I can imagine. You both get a fright. Yeah. She was quite concerned, which is understandable. Sometimes people have been together for years and years, and it's only in later life that things maybe start to go wrong. And they were both elderly, and I think sometimes that's an issue that maybe the person who's caring for them could do with some additional support as well. Michaela's done a grand job of cleaning you up. You've not spoilt your good looks anyway.
Back in the early 60s, they said I looked like Elvis.
Oh, did you?
Can you sing like Elvis?
No.
Thought we were going to get a wee song there.
So Jimmy, see, because you've had a fall today and you've banged your head, I think it would be a good idea for a wee trip up to hospital to get you a wee check over.
You think so?
I think so. And your wife's saying that you've been complaining a lot of pain in your chest as well. The fact that he'd had the fall and his mobility was poor and he was still complaining of some pain, then it was really only appropriate for him to go into hospital rather than to be left at home.
In hospital, Jimmy's injuries will be checked further, and the source of his neck and shoulder pain will be looked into.
He's lovely. It's people like that they make your day entertaining, and they tell you all their stories. It's just brilliant. Love it.
In Bathgate, Kevin and Martin are concerned by Kerry's vomiting.
Sorry, there you go. Maybe a big bit stingy. So what do you think then? You'd rather just come into hospital? Yeah, I think it's maybe for the best, to be honest. We can get you lying down in the ambulance and get you a sick bowl and stuff, alright?
That normally, if you develop some kind of vomiting bug, you'll be probably violently sick 2 or 3 times till your stomach's empty, and then you more kind of go into a kind of retching phase where you maybe bring up a tiny little bit of spit or something, but there's not really anything else to come up. But I think with Kerry, the longer we spent with her, and as we saw, her high temperature, kind of the persistent, horrible kind of bile vomit that she was bringing up, Every one thing adds like another layer. Gives you that bit more of a picture as to how unwell she is and the fact that she needs treated a bit quicker.
Right.
So we lie down on there, Kerry.
Because Kerry is in such discomfort, the crew want to give her anti-sickness medicine intravenously. But finding a vein to cannulate is not easy.
We'll have a quick look, and like I say, if there's not an obvious vein, I'll no bother, because I'm not going to stick needles in you for fun now. Sorry. Got to be cruel to be kind.
When you become a bit dehydrated and you're unwell, people's veins can kind of become harder to find. They can become smaller and kind of hide under the skin a lot deeper.
Right, there's a wee vein there, just on the inside of your arm. You okay if I've just one try it, see if we can get that? Right, a wee sharp scratch, nice and still for me. No, right, we'll just leave it. It was in the vein, but I think you've got a wee valve or something there that it's not going to put anything through it, so we'll get you to hospital, okay? And I'll check your blood pressure on the way to the hospital, but I'll just kind of leave you in peace, alright?
These are all things that someone who's normally fit and well could quite rapidly get more unwell with it, and she could become dehydrated. The infection could get worse due to the dehydration and everything. And before you know it, you could end up with someone who's suffering from sepsis, which can be a life-threatening medical condition that does need to be treated quite rapidly. So even though on the surface a young, healthy person with a vomiting episode might not be too severe, it can develop into a more severe illness.
Because A&E is so busy, Martin calls ahead to try to secure a bed for Kerry.
BP's 124/78, SAT's 100, pulse 92. She's just feeling absolutely rotten. She's had some ondansetron, which seems to have settled the vomiting down a bit now. Kerry, do you think you'd be okay to sit in a chair for a while in the hospital just to get a wee space for you? No, she says she's feeling rotten, too rotten to sit.
Right, she might have to wait with you then for a little while until we can find some space, sorry.
That's alright, no problem.
If you can get it booked in, that'd be great.
We'll do, and then we'll just wait to get the nod. Okay, thank you for that. No problem, cheers, bye-bye. Right, the space that we had when I first phoned, so they've given it to someone else. So there's no room for you at the minute, I'm afraid, Kerry, so we'll just have to sit and wait in the ambulance for a wee bit just now, okay? Right, hopefully not too long, okay? At least you're comfy on the bed just now. Anything else I can get for you? You alright? Just want me to shut up? I've been told that many times before.
When we go to the emergency department, we have to wait outside. It can be anything from 20 minutes to an hour and 20 minutes, it varies at different hospitals. So the whole process of getting the patient in, triaged and booked in and to see a doctor, the patient could be waiting anything up to 7-8 hours to see the actual doctor.
It's 11 o'clock in the evening in Dalkeith.
What a busy night it's been tonight.
Paramedic Scott and technician Kim are halfway through their shift and hoping for a break to grab a bite to eat.
Looking for a job for us?
Yeah.
Hurry up, baby, there's a screen. Muscle bra for 8-year-old male. 999 activated. So he's been waiting since 20 to 10. So it's an hour and a half. So it's a guy who's fallen and he's still on the floor and he had an injury, I'm guessing.
Yeah, it's because it's dwindling away, isn't it?
Yeah, it's just a thought, wasn't it? We're obviously not going to get there.
Possibly this block here.
What's your name? What's your name?
Raymond.
Hello.
Right, so, have you had a fall?
I've had it before.
Have you?
It's a hip that got done, redone.
So you got a hip replacement?
Hip replacement. And a couple of years ago, and it twisted and it come out. So I know the feeling.
I think the patient knew himself, especially from previous injuries that he's had before. He was quite certain that the exact same had happened.
I was putting my foot, I've been bothering on my back and I was putting my foot up on the step.
Right.
Just.
You just like jerked the wrong way, yeah.
You can see by examining the patient that there's some shortening to that limb and some internal rotation in this case, so these would be signs that the patient does actually have a hip injury.
And he had tied like a belt round his other leg to support this leg.
The patient had basically immobilised the limb himself.
Have you got pain in your left hip just now?
No, if I move it.
If you're moving, right.
Screaming agony.
Yeah, so if we were to get you up onto a chair, that would be just way too much pain just now. No, that's fine. We can get your pain sorted that way, all right?
If you have got a dislocated hip, there can be complications from that. If you're not getting adequate blood supply to your lower limb for a period of time, that can be a worry. So this patient needs to go to hospital to have x-rays and be examined.
And how's your health? No, don't be sorry. Oh, we're busy, but you're definitely needing seen. You're needing to go to the hospital for this, eh?
If there's any way to sort it myself.
I bet you get a hammer and just bash it back into place.
Some super glue. It's a sore thing.
Yeah, I imagine. Have you ever had gas and air before?
Yeah, it doesn't work.
It doesn't work for you. Do you want to try it just now until we get something else set up? What you do with the gas and air is you just take nice deep breaths through this mouthpiece here.
The gas and air is just a stopgap while the crew prepares some more effective pain relief for Raymond. He needs morphine.
Can you make a fist a few times? I'll have a try here first. I'll just go for a small one in your hand, okay? Do you want to swap that onto this hand? Your pain relief? Yeah, perfect. Right, no pressure here because this is just a wee squiggly one.
Quite difficult sometimes to get these wee. How are you feeling just now? Alright, if you're not moving, eh?
Can we swap hands again?
That's the best thing, yeah. Swap anything.
As long as we get rid of the pain, eh?
I used to be a first aider.
Oh, well, you've got it all covered. Okay, another sharp scratch going, okay? Not having any joy there. Right, this is the last time I'm going to try this, okay? Then we'll have to look at someone else.
Scott is struggling to find a suitable vein, which is a common difficulty when treating elderly patients.
Only other alternative is one in your foot. Right.
That one could be a potential, but probably not, to be honest. It's really, can't see it, it's just feeling.
Sorry, I know that'll be a bit more nippy there. We just want to try and get some pain relief on board for you.
Yes, please.
The crew cannot move Raymond without treating his pain first, and they're having no luck finding a vein to take the morphine. At the ambulance control centre in South Queensferry, Sarah is dealing with an increasingly distressed caller.
Ambulance service, is the patient breathing? Is the patient breathing? Is the patient breathing? Is the patient awake? Okay, what's the address of the emergency, please? Okay, tell me exactly what's happened.
A woman and a child have fallen.
It's unusual for two people to fall. A lot of the times you'll find maybe it's an elderly couple, one falls, one tries to help them up and the other person falls as well. Ah, right, okay, understand.
Sarah needs to glean as much information from the caller as possible. This will be fed through to the crew on scene.
And what caused the fall? Okay, okay. Is there any serious bleeding? Okay. Okay, is the blood spurting or pouring out? No. If there's only a little amount of blood, we don't feel we need to then give control bleeding instructions, but if the blood's spurting or pouring out, we need to then give control bleeding instructions to try and stem the bleeding. And is there any other injuries apart from the head injury? Not that you can see. Are they having any difficulty breathing?
Whilst these questions can often frustrate the caller, it is vital the call handler gets as much information as possible, and they do not delay the arrival of a crew.
So I'm organising help for you now. Stay on the line. I'll tell you exactly what to do next, okay? Right, listen to what I'm saying to you. This isn't delaying any help, but I need you to concentrate on what I'm saying to you, okay? Because I'm going to give you instructions, but I need you to concentrate, okay? So it's always a common worry that our questions are delaying people's help on the phone. You'll find a lot of call handlers say before they even start the questions, I'm going to ask you some questions, it's not delaying any help. But sometimes when people are in stressful situations, they don't listen to you. From now on, that's okay, don't worry. From now on, don't move them unless they're in danger. Don't splint any injuries, okay? Just leave them where they are, okay? Now, I know the wee boy's conscious because I can hear him in the background there. Is the lady still conscious? Can you get any response at all? It's making sure we're sending the right people and the crew ultimately know exactly what they're coming to when they get there. Now, that's the help arranged for them. We'll get someone out for both of them as soon as we can, okay? If you get any more information or anything gets worse in any way, give us a call back. If not, someone will be there as soon as they can, okay? All right, take care, bye-bye.
In Musselburgh, 83-year-old Raymond has dislocated his hip.
I'll pop this in your ear. I'll go for this ear.
He needs to get to hospital and is in severe pain, but the crew are struggling to give their patient the pain-killing drugs he needs.
So the normal preferred route for us would be to give it through his veins. That's the most effective and we have the most control over that. But in this case, it was a difficult cannulation, so after a few attempts, we gave that up and went for the IM route, which is just an injection into the muscle.
I think it's still effective, it just can sometimes just take a wee bit longer to sort of set in.
Give that a few minutes to work, okay? And check your blood pressure again.
So you've got to take it.
Yeah.
Then
See how you get on with that one, alright?
Okay.
yeah, fine. It's fearful, I know what's coming next.
I know, it's a thought, isn't it?
So you can still take that gas and air as well when we get you up. Or now if you're needing it.
We can grab a chair, eh?
So it's a nice deep breath until you hear that sound.
He was already in a seated position, so it was just a case of getting the chair up next to him, get him transferred onto that chair, and then take him out to the ambulance trolley that way.
We'll go for one more puff and then we'll go for it.
So it'll be all your weight into this good leg. We're going to support you. You're not going to fall, whatever happens, okay? And the chair, can you see what it is? Yeah?
Yeah.
Okay. So we'll support you. 1, 2, 3. Well done. You're doing really well. You're doing well.
Pick up, madam.
That's you.
Sorry.
That's you. That's you. Well done. Perfect. Well done. Well done. Can you get yourself comfy?
It's not right because it's not in place. Here's the gas for you. That's it.
And then we'll support your leg. And we'll get you, once you're in the ambulance, you've got to be lying flat, okay?
So do you think you'll be able to put this leg onto that bar? Yeah. Perfect, Jay. Let's get you out.
We maybe got to go and do a turn.
After almost 3 hours stuck at the bottom of the stairs, Raymond is finally on his way to the hospital.
Well done, you're doing well.
So we 3-point turn. Okay. Get in there. Once we get you lying down, you'll be nice and comfortable, okay? Are you able to stand up with your good leg again? If we support you, and we just want you up and over that direction. Well done.
A bit strong man at the back.
I know. Thank
How's
God,
that?
eh?
Right,
Make yourself a bit comfy.
We'll get a couple of crack straps round it, and then hopefully that'll be...
I'll get up. Anything that does anything?
Some people say it's really good and others say not so good. I'm just going to stick this band on your wrist just to say that you've had some morphine, okay?
Must be nearly there.
Yeah, we are. We're literally just pulling in.
It's your first mate.
Scott.
Scott. Thanks for the news.
That's okay. You've been the perfect patient.
Alrighty, there's a wee space for us in the
There we
middle.
go.
Hopefully it's the last time, eh?
I've not got that many years left.
Ah, you got plenty left.
Plenty of time to dislocate your hip.